Hello, welcome to VMC. I'm Dr. M. Today we are going to discuss environmental modifications that we can do to help manage our cats that are dealing with arthritis pain. So join me, you'll learn something today. Implementing a physio, rehab, or conditioning routine could be a wonderful option for your cat. We do have rehab veterinarians who have specialized in rehabilitation that would be very helpful here. They often will consider things like underwater treadmills to take some of the weight off the joints while still encouraging muscle use and range of motion maintenance. Not all cats are going to be accepting of these sorts of treatment modalities, and the stress of taking your cat to a rehab facility might be too high. It could be a better option to get an at-home routine to work on some balance and conditioning and muscle maintenance, as well as to help maintain your cat's range of motion for their joints and to reduce the amount of compensating that they do with their bodies. Once they get painful in a certain area, they will compensate how they move because of the pain, and that can lead to pain in other parts of the body. This is why working closely with a rehab team can be beneficial for your cat. I will link in the video description a canine conditioning group that's very research-based. I know they talk the majority about dogs. However, they do have some fitness experts that also work with cats and that put out information for feline fitness and feline conditioning classes. It is absolutely crucial that modifications are made within the home when your cat has arthritis pain. Most commonly, this means adjusting the amount that they need to jump. You can add stairs or ramps. Those things can make a lot more of your house a lot more accessible for your cat and reduce the pain they feel trying to get up to the spaces they feel safe enough to rest in. Cats do really need elevated resting and sleeping areas, and if they're painful, they will struggle to reach them. So you need to modify their route to get up to those areas. We also need to consider adding things like a heated cat bed, as warmth can be quite soothing for chronic pain. They'll quickly tell you if they like that or not. Or adding kind of an igloo type bed style for them can also be helpful, as it will keep them a little bit warmer. This also means you might need to adjust the style of food puzzle that you're offering for your cat. They might need it made a little easier, or they might need a different type of food puzzle in order to reduce joint pain. You can also cut holes into the walls of your litter boxes so that they don't have to jump over or even step over a lip to get into the litter box. And doing the rest of the litter box husbandry that I discuss in my litter box husbandry video is key. You will need to make sure that your cat easily has access to food, water, toys, resting areas, and litter boxes in every area of your home. If they have to go a significant distance or do a lot of jumping or running or stairs, or if they are worried about getting by other pets that are around, they will not access the resources as often because they're painful, so they're avoiding that movement. And that will result in them losing weight or becoming dehydrated or house soiling and so on. So you need to increase the number of resources your cat has available in order to make it very easy for them to access the resources they need. You might also need to experiment with changing the orientation of the scratching posts that you have available to your cat. If they used to use a lot of scratching posts in a certain orientation, that might now be painful, and making modifications might encourage them to continue scratching. Them doing that scratching is an important part of their behavior. It also encourages stretching and range of motion for the joints in their body. You can also consider using things like catnip and silver vine, etc., in order to entice your cat into doing a bit more movement or a bit more scratching. It will also be very important that you implement everything you can in order to reduce stress for your cat. When any species is stressed, that worsens the pain that they feel, and chronic stress will worsen chronic pain. So keeping their schedule the same, giving them safe spaces for if company comes over, all of those sorts of adjustments will be crucial. I want to add a note here that not every veterinarian will have the tools in the toolbox in order to help you fashion a multimodal treatment plan that is fitting the current standard of care. There's so much research that comes out all the time and things change so often. Not a single one of us can keep up with everything. We also as individuals have things that we like and dislike and areas of practice that we're more and less comfortable with. So do not hesitate to be a strong advocate for your cat. Bring in video of the changes that you notice. Discuss the decrease in mobility and activity that you are seeing at home. Make sure that you advocate for your cat, and if your veterinarian is not able to help you, you may need a second opinion, and that's totally fine to do. You may need to be referred to an orthopedic specialist. That's also totally fine to ask for. Make sure to be the voice your cat needs, because they cannot tell us how they are feeling, and we need to be very aware of any small changes in them so that we can best address any pain that they might be feeling as they are aging. Because osteoarthritis is a progressive disease, it's also crucial that you are doing regular quality of life assessments. I will link in the video description a video I did discussing quality of life. This is an important thing to think about. There will come a time where we are doing every single intervention we can be for your cat, and there will come a time where that is no longer enough. This could be because of arthritis. It could also be from a variety of other issues. When we get to that part, it's so important to be discussing humane euthanasia. We don't want our cats to suffer. Euthanasia can be such a lovely gift that we can give to them in order to relieve the constant suffering and the decline that they would otherwise experience. It's not an easy topic to talk about, but it's one that we have to be aware of and to think about. I also want you to remember that because this is a progressive disease, when you see your veterinarian and the first part of their arthritis treatment plan is implemented, hopefully that will be enough to help manage your cat's pain for a significant period of time. But as the arthritis progresses, interventions will need to be added in order to maintain your cat's quality of life. This is normal. Don't just get the NSAIDs and think, okay, this is it, we're done. Arthritis treatment plans must be multimodal in order to be most effective, which is everybody's goal. Please look in the video description if you're wanting any additional information. Thank you for joining me today. I would love to hear what you learned from today's video, or if you have a topic that you would like me to cover in the future. I'd love getting the comments, and I'm happy to add any suggestions to my list for future video topics. I do put out a new video most Fridays, and so I look forward to seeing you in the next one. All right, bye for now.